Hi, my name is Jenny Welch. I'm a registered nurse. I've been a nurse now for approximately 15 years. I come to you today, though, as a nursing student once again. I returned to school to finish my bachelor's degree, and I just wanted to reach out to my fellow nurses and nurse leaders and talk to you a little bit about maintaining safety for nurses in the workplace. All the information that I have that I'm accessing today came from 4 main journal articles that I found in the Association of Perioperative Registered Nurses, or the AORN Journal of Nursing. They will all be cited and referenced below the link, with links to the full articles if you would like to read them. Additionally, I've put some toolkits so that you can monitor and review your own protocols for safety in the workplace and see if they need any updating. We're going to start out in the operating room and talk just a little bit about the occupational hazards that are specific to the operating room. Of course, some of them can be hazards anywhere, like slips, trips, and falls, or strains, muscle pulls, and injuries due to lifting and moving patients. In the operating room, especially, we're going to have extra instruments and cords related to lasers and stuff needing to be plugged in that are going to be run along the floor that we'll need to be careful of. Our patients will have anesthetic and will not be able to assist us, so we'll need to ensure that we're using proper body mechanics and have training and everything in place so that we continue to use the right strategies to move the patients and wait for assistance if we, need, instead of just moving them ourselves and thinking that we can do it. Diseases is another occupational hazard. We're exposed to blood and body fluids every single day. And we need to ensure that we have the proper PPE in place to make sure that we don't end up being exposed to some form of disease or blood-related injury, like hepatitis C or HIV. Every year, approximately 380,000 healthcare workers receive needle sticks, and 1/3 of those are accounted for in the operating room. Additionally, in the operating room, 500,000 healthcare workers are exposed to toxic gases and vapors related to the electrosurgical units and lasers that are used while operating on patients. Lasers are used more and more frequently for operations. They're more effective and efficient, and the toxic fumes can be equal to about 30 unfiltered cigarettes, and that's just one day's exposure. So it's very important to have proper masks and PPE in place for that as well, to protect our lungs and have proper ventilation within the operating room to help as it can be. Again, safety protocols, the policies and procedures in place to prevent and help maintain safety in the workplace. They need to be monitored for effectiveness and changed as needed to meet the changing technology that we face every day in healthcare. Bullying in the workplace is also an issue, safety that nurses are up against for safety in the workplace. Then some of the negative effects of bullying in the workplace can be related to emotional well-being of staff. Also, patient safety is at risk when there is bullying in place. Nursing is a profession that has been known for many years as eating their young, and it's been overlooked by management for far too long. A mandate from the American Medical Association stated that they need to have policies and procedures in place for zero tolerance to ensure that bullying doesn't continue, and there should be safe reporting methods, and people should not have to fear retaliation. Bullying can take place from nurses to nurses. It can be nurse leaders to nurses, and it can be the staff that report to us that can be disrespectful and can actually be bullies. 59 in a study in 2013 in the American Perioperative Registered Nursing Journal, the study showed that about 59% of the participants reported witnessing weekly episodes of bullying, and about 34% reported at least 2 acts per week of bullying in the workplace. Recent study in the American Nurses Association that had 3,765 RN participants. Of those participants, 50% reported being bullied themselves by a peer, and 42% of them reported being bullied by one of their supervisors. Bullying can be either overt or covert. Overt meaning that the person that is bullying has outbursts, they yell, they throw things, they basically temper tantrums. And a covert bullying is more of a purposeful wanting to watch someone fail. They leave pertinent information out of a report so that you can't perform your job appropriately. Or they take a nurse who has just newly obtained their license, and they just leave them out on the floor to sink or swim and don't help them as they need to learn and grow their job. Bullying is described as disrespectful or unprofessional behavior that is learned, tolerated, and reinforced in some healthcare environments. Healthcare team members and leaders can be victims of bullying. It doesn't stop with any certain person. Bullying behaviors should be reported, but most fear retaliation, so they don't report them, and it ends up affecting their job. A lot of nurses leave the profession because they just don't feel safe, or they can no longer tolerate the emotional stress of the bullying, and we already have a nursing shortage in place, and this just adds to the shortage. Because bullying can be so effective on a nurse's psychological well-being, it can trickle down to our patients and affect patient safety. Organizational leaders should develop policies and procedures that support zero tolerance, as I mentioned before, for bullying in the workplace. And leaders should encourage teams to obviously report and not fear being retaliated against. All team members should and do have an ethical responsibility to encourage and contribute to a healthy workplace. The environment should be conflict-free and promote patient safety. The Joint Commission suggests development of policies and procedures that should be reviewed frequently for the need to add or critique as needed, and they should involve education for nurses, doctors, and interdisciplinary team members as well on expectable behavior and reporting options. They should be spelled out perfectly so that there is no error. Additionally, there should be enforcement. The code of conduct should be consistent and equal for all members and all staff. There should be zero tolerance policy written, and they should be presented on employment so that there is no mistake from the very start. There should be no retaliation. Protection should be in place for those that report. They shouldn't have to fear what might happen. Specific disciplinary actions should be written into the policies, so it's very clear and concise what could happen if you would bully another team member. There should be loss of privileges, suspension, and even termination if need be, if the bullying continues. Assessment of staff members' perception regarding seriousness and risk of harm to patients should be completed frequently. Additionally, development and implementation of reporting and surveillance systems for recognition of intimidation and disruptive behavior should be also completed. Use of concerned, uncomfortable, and safety, or the CUS tool, should be utilized as needed. Additional team steps communication programs are available for healthcare workers to use and should be made available as needed. From there, we're going to move into active shooter training, unfortunately, which has become a need over the years, recent years, more and more. A study in Denver showed that more and more active shooters related to retaliation from either healthcare workers or our patients coming in, disgruntled employees and so on, have come in and caused issue with active shooters. In Denver alone, excuse me, they had to develop an active shooter program in their healthcare system. They have a healthcare system of 525 bed hospital and a level 1 trauma center. Additionally, they have 8 community health centers. They have a multi-tiered training program that they developed that involves education for staff. It builds relations with the community responders, the police, including the SWAT team, and the fire department. And it helps the preparedness of all staff. Excuse me. And helps to just get everybody on point so they know exactly what to do if an emergency would arise within their hospital system. They use a process called run, hide, and fight. You're supposed to run and call 911, hide if you can, and fight if necessary. They also continue education for a fourth thing that is treat. So that if somebody is injured, they can do first aid for gunshot wounds or whatever is needed. And they also teach this, but these are for volunteers. So there's specific staff members that are called to volunteer to learn the last step of treat. The hospital system in Denver also runs annual training. They actually have the SWAT team come to the hospital and they go through active shooter. They have volunteers that act as the shooters, and they run through the entire scenario to ensure that every staff member is up to par and they know what to do in the situation. These are all things that are necessary to ensure safety and to make sure that our nurses and healthcare members are safe and that our patients are safe. Having these policies and procedures in place and continuing to update them as needed is absolutely necessary. And as a fellow nurse, I hope that you take all of this seriously and work to improve the system where you work. Our voices are important, and you need to just speak up and make sure that everyone is taken care of. Again, everything is referenced below and linked if you would like to any additional information. And I thank you for your time.